Hello, Monty. Thank you very much for joining me for our virtual event today. Please could you start by introducing yourself and telling us a little bit about your work?
Yeah, sure. I'm an academic clinical fellow at the University of Oxford, which means that I'm a medical doctor specializing in psychiatry, so that's the clinical element of it. But I'm also an academic, so I do research as well. So it's sort of 75% seeing patients and 25% research. And then the other 0%, I write nonfiction books as well.
Could you please explain what you mean by the term immunopsychiatry?
It's looking at how the immune system can influence mental health, but also how mental health can influence the immune system. And we're at a really exciting stage in this emerging field, and there's a lot of amazing science that's only really come to the fore in the last decade or so. And we're starting along the journey of seeing how this might translate into therapies for people.
What led to your interest in looking at health in this way, in the way that the mind, the body, and the immune system are all connected in a way that hasn't perhaps been explored before?
I was always fascinated by it, the sort of our body's army that manages to fight invisible microbial foes. And I was always just curious that it seemed to be a complex network that's sort of self-managed. So you've got different types of cells that can fight off different types of bacteria and viruses, but also initiate wound healing. And they can communicate to each other in lots of different ways via different molecules and receptors across lots of long distances. But also how they sort of can not only just organize these attacks or these repair jobs, but also how they can develop a memory for bacteria and viruses that have infected the human host or the human organism years ago. And it seemed like the immune system was a bit of was similar to the brain in a sense. The idea was that the brain focused on defending us against big threats, macro threats, like a lion or someone else like another human trying to attack you. And the immune system was more for the microscopic threats. But actually, in the last 10 or so years, we've discovered that that's completely not the case. And there's some really exciting science that I could talk about later that shows how they are completely interlinked, and they're actually you could say that they're a combined defense system, which is really exciting. I always knew that when I was psychologically stressed with exams coming up or whatever, my eczema would flare up, and there didn't really seem to be any answer for that. And then when I started practicing clinically, what was really interesting, so that was felt the mind was affecting my immune system, but in the opposite direction, often when I was seeing patients, say with clinical depression, and they were having a course of CBT or something like that, so cognitive behavioral therapy, and their sort of depression scores were improving. When some of these people had a short-term virus, like a cold or whatever, their depression scores would go up massively, but just for that short period of time. And it was really interesting that most of the symptoms of being sick with a bug of some kind are actually mental and are very similar to depression. So it seems that, like, when we're infected with a microorganism, the immune system wants the brain and the mind to be involved as well.
Your work mentions a lot of the notion that we go to one hospital for physical health and a completely different department or a completely different hospital in some cases for mental health. Can you explain how you think a more connected approach is beneficial?
Generally speaking, lots of people in mental health, psychologists and psychiatrists, often find it difficult approaching physical health conditions or thinking about physical health alongside mental health conditions. And also, that's also the same for a lot of quote unquote physical health doctors in physical health hospitals. And part of this has been due to a conceptual sort of belief that sort of permeated a lot of our society, which is called sort of Cartesian dualism. The mind is a completely separate essence to the body. So the human body is like a machine, but the mind and the mental health is completely separate. And in a way that was quite useful for discoveries in things like surgery and understanding how organ systems and various things within the body worked. And there were huge huge amounts of growth over the past few hundred years in that regard. But that came at the expense of sort of ignoring the messiness of the human mind. The research is fairly new, and it's sort of said it takes 17 years on average, but it varies massively for something to come from the lab into the clinical world as a treatment. But then actually getting organizations and hospitals to kind of think more collaboratively, it does take a long time, and change can be difficult. But there are lots of people and organizations who are trying to focus on physical health in mental health environments and mental health in physical health environments. But the long and the short of it is it's becoming very clear that there's no mental health that isn't also physical, and there's no physical health condition that doesn't have a mental aspect. You know, the human body isn't designed to house lots of nice different systems, you know, like the gastrointestinal system or the brain or the heart. They're all combined for a purpose. One of the main ones is survival and defense. And all of the systems are completely interlinked. But all of our medical specialties are very divided. So basically it's we are moving in the right direction, but it's a huge challenge and it's a huge opportunity. But I think when we get it right, it will have a huge impact on how we see health and how we treat disease.
One of the little bits of your book that stood out to me was when you mentioned the mice being motivated to move by their gut microbiome, because I really never had considered anything like that before. Could you tell us more about that?
Yeah, there is some really interesting sort of early stage research using animal models and then sort of converting some of these to human models of the links between the immune system and the microbiome, which is the huge community of microorganisms that live in and on us. You know, we have as many microbial cells in and on us than we do our own human cells, roughly, which is why I say I think we're most human just after we've done a poo, because actually that's
we've got rid of some of them.
Got rid of some of the microbial friends. Basically, they looked at about 200 genetically diverse mice, and they saw how much they were willing to exercise if they were in a sort of a box with a treadmill, how much they sort of actually chose to exercise, and when they were forced to exercise, how much endurance they had. And then they looked at loads of different parameters, so kind of loads of blood molecules, genetics, and their gut microbiomes. The makeup of the gut microbiome had a hugely predictive power over seeing how much exercise these mice were willing to do. And then they did a number of really interesting studies with these mice, say giving them antibiotics to remove the microbiome, and if the microbiome was removed, then they exercised 50% less. And to cut a long story short, they worked out that some molecules from I need to say actually that most of the microbes in our gut are beneficial. They're either actively beneficial for us, so they kind of produce molecules that are good for our body and our brain, or they're just good because they take up space that bad bacteria might take up, if that makes sense. But basically what this study found was that some of these good bacteria produce these molecules called fatty acid amides that are molecules that activate certain nerve receptors in the gut that travel up to the brain and release dopamine during exercise. So basically the microbes were causing runner's high. I'd started to be more mindful about my diet and to try and increase my microbial diversity in my diet. And basically that meant slowly increasing the amount of plant-based fibers I ate, and also introducing fermented foods into my diet. And basically I used to exercise loads as a teenager in my sort of early 20s, but I haven't for a very long time, basically. And every sort of every New Year's resolution of trying to do running or whatever, I just give up after a couple of weeks. But actually, I just found that after I'd been on this diet for this very slow change in my diet, I'd actually desired to go out running and doing some exercise and things like that. And this was before the study came out, so I just found that really interesting. And what would be really exciting, it would be, and this is what's happening at the moment, are studies to look at how this could affect humans, and whether dietary changes increases exercise, because we know that exercise is really good for physical health, mental health, the immune system, but it's really hard to initiate. But if we can get our microbes to help us out, then maybe that could be a really good way of sort of breaking that cycle. And sort of why that's the case, it's really interesting. We could theorize that sort of microbes might want us to move more, or maybe what the brain and the microbiome have sort of co-adapted to do is that the brain uses microbial diversity in the gut as a sort of a marker, a proxy for how much nutrition there is in the diet, it's sort of in the sort of in the intestines at that time, so that actually the brain's like, okay, yes, we can move a bit more now. We now have the technology to show that, say, psychological stress can activate the specific immune cells, and also that the brain can remember inflammation in the gut, and the brain can sort of communicate with immune cells in the gut.
Are there any particular populations, sort of individuals with autoimmune disorders or anything like that, where the link between immune function and like mental health or mental illness is particularly pronounced? Is it common across a group?
Looking at mental health, for example, say depression, I mean, to have the diagnosis, there are lots of different symptoms. You need to have the core symptoms of persistent low mood and a reduced ability to experience pleasure, but there are lots of other symptoms that you need to have with it as well. But actually, there are, and research have estimated that there are about 227, I think, different combinations of symptoms that would give you a diagnosis of depression. And it's clear that there are some people who have depression that they respond well to antidepressants, but lots don't. Some respond best to psychological therapies and things like that. But what's really exciting is that with a group of people with depression is starting to emerge, about potentially a quarter of people with depression. And this group is being termed either by some groups inflamed depression, and by other groups immunometabolic depression. But that's basically this group of people tend to have higher levels of inflammatory markers in the blood, higher levels of immune system inflammatory cells in the blood. They tend to be the people who don't respond as well to antidepressants. And also their symptom profile tends to be a bit different. So they tend to have more fatigue, more of a desire to sleep. Some they tend to eat more, some eat less. So there's a bit of debate about that, but changes in appetite and things like that. And what's really exciting is that there's some early evidence that maybe anti-inflammatory medication might be helpful at reducing and treating depression in these people. The idea of that was first discovered by rheumatologists, so joint specialists, in the early 2000s. They were given these really cool anti-inflammatory medications for rheumatoid arthritis. And they discovered that a lot of their patients it had a side effect of their mood improving massively. And importantly, this was also in people whose joint issues, whose rheumatoid arthritis didn't actually improve. But regardless of that, reducing inflammation improved for some people completely treated clinical depression. Conversely, some researchers in the world of liver medicine were actively inflaming people, giving people an inflammatory medication called interferon to try and for people who had hepatitis, which is a virus that lives in the liver. But interestingly, half of the people who were given this inflammatory molecule to sort of destroy this virus developed depression, and many of these people ended up with depression afterwards, even after the treatment. So yeah, to cut a long story short, it looks like there's perhaps a quarter of people with depression who might benefit from anti-inflammatory treatments. People with autoimmune conditions are much more likely to develop various mental health conditions, including psychotic illnesses such as schizophrenia, where someone's perception of reality, basically someone begins to lose touch with reality, so you get hallucinations and delusions. And it's really interesting that people with, say, schizophrenia are much more likely to develop an autoimmune condition, and vice versa. If you have an autoimmune condition, you're also more likely to develop schizophrenia. And in a in a small but significant proportion of these people, it's probably lower than 10 with schizophrenia or with psychosis generally. It's probably lower than 10%. There's evidence that antibodies, which are immune molecules, are attacking the patient's brain. And when these people are identified and they're treated with immune treatments, they can completely recover, which is pretty remarkable. But then also there's evidence that things like post-traumatic stress disorder and stress-related disorders lead to an increase of autoimmune conditions and things like that as well. Not in everyone, but there's an increased risk generally. So it's this idea of having a more genuinely holistic idea of mind and body is hopefully going to permeate medicine moving forward. There have been more studies that have looked at lots of different types of these studies using these fancy new anti-inflammatory drugs for things like psoriasis, eczema, rheumatoid arthritis, etc. And they look at patients who haven't improved on the primary outcome, so the psoriasis or the rheumatoid arthritis. So they haven't improved in the kind of sort of physical parameters, but their mood improves, and that's being seen across the board basically. And some of these new anti-inflammatory medications are now being tested in people with depression, but no sort of physical conditions.
What sort of further advancements or understandings between the link of mind, microbiome, body would you like to see, or would you expect to see in the coming sort of 5, 10, 20 years?
I think the key thing is being able to identifying who needs what, if that makes sense. So it's being able to work out who has, say in depression, who has depression that might be worsened by inflammation, so inflamed depression. And then what are the treatments for them? So what kind of blood tests, maybe helped by things like AI and things like that, can detect this population? So you go to your GP, your family doctor, and you have a series of questions that they normally do for something like depression, but then you also have a blood test, maybe even in the future a microbiome test, and then people can be given the correct treatment. So it's sort of moving towards personalized medicine. I think from an understanding point of view, I think it's really key to understand that psychological therapies are also biological therapies, because people, when people are living with chronic conditions, and there's any suggestion that they could have psychological therapy as a means to help them with whatever chronic condition they have, people understandably feel that it means that, they're saying it's all in my head.
Yeah.
It's something to do with me, my personality, which couldn't be further from the truth. So interesting animal studies that have, so 2 years ago, there was a really interesting study where mice were given basically a kind of an irritant that caused inflammation in their bowels, and also in the kind of and in a separate group in the sort of the peritoneum, so kind of the lining of the abdominal cavity. And these researchers use this new technique called chemogenetics, basically, to detect the exact cells of the exact sort of regions of the brain, the exact neurons in the brain that were activated during this inflammation. And then what they did is they rested the mice for a period of a month, so they recovered completely. And then they only activated the brain cells, so not introducing anything to the gut. And just activating those brain cells re-inflamed the gut. And similar other studies are finding that actually that psychological stress can cause a release of molecules from muscles. So that the nerves come down from the brain to muscles, that these molecules then recruit immune cells from the bone marrow, which is where sort of their barracks, and move them out onto the skin, into the surfaces of the body, into the gut. So and cause inflammation, basically. So we know that psychology is biology, that thoughts can be literally inflammatory. In the book I mentioned, we often can fall into two groups. We can be the minds or the bodies. We can over psychologize conditions. We can over physicalize conditions. But actually, hopefully, this sort of it is a revolution in science, which looks like it's going to become a revolution in medicine as well. And hopefully, that will be a revolution in the way we see the human organism generally. So basically, everything I've said by and large is in the book. It's called The Immune Mind, and it looks at what it is to be human. It looks at the relationship between the mind, the immune system, and the microbiome, how all of these things are completely interlinked. A lot of it is exploring this new, really exciting science behind how we now know that the brain, which we previously thought was completely separate from the body, is deeply connected to the immune system and how they both influence each other, which was something that we didn't think about, didn't believe until very recently. So we look at it, so the book looks into the science behind that, but then it looks at sort of how that could, and that is helping people with various mental health conditions and physical health conditions. And then it looks more broadly at things that we can do in terms of our lifestyle, in terms of diet, exercise, and the way that we relate to others and things like that, and how that can be an evidence-based but holistic way of living. So it's got quite a broad scope. There are basically lots of interesting rabbit holes that one can go down, and I think that it covers quite a broad scope. So that I think there'll be something in it for everyone. So I think what I'd encourage people to do is if they to read it, but also there's a huge number of scientific references in there, and I talk about other books that relate to different elements of the immune system and mental health. So hopefully this book will be a sort of springboard for getting people to look into the science, the really exciting science behind the immune-mind connection.
Yeah, absolutely. Really exciting science is what it's all about. Thank you so much for joining me today. It's been an absolute pleasure to talk to you and absolutely fascinating.
Thanks, Eleanor. Great questions. Loved it. Thank you.
Wonderful.